Heart disease is the leading cause of death in the United States of America. And we're talking about more than lung disease, more than cancers, more than Alzheimer's, more than strokes. And it's important for us to understand this because there are certain things that people present with that if it is understood, treated, you can potentially prevent heart disease from happening. And when I say heart disease, I'm talking about stroke, I'm talking about heart attacks, heart failure. And some of the same risk factors for heart attack, stroke, can also lead to strokes, can also lead to clots in the legs. So if you understand this more and we get it treated, we could potentially spare the lives of a lot of people. And how many people get diagnosed or get die due to heart attacks or heart disease? It is roughly over 700,000 people die from heart disease each and every year. My name is Dr. Isang and I'm a cardiologist, and I use this platform to discuss things regarding the heart, health, and prevention. Now let's just get back to it. Heart disease, heart attacks being one of the prominent ones. What are some of the signs, what are some of the symptoms that people have? Not everybody's going to have the old crushing chest pain. Elizabeth, this is the one. Some of them can have chest pressure. But one of the things that I want to remind people is that if you're having these pain pressures, and it's worse whenever you stress, whether that's physical or psychological, it could be a heart attack, it could be heart disease. If you're having pain when you're exercising, if you're having pain walking up a flight of stairs, if you're having difficulty with pressure, listen to your body, it could be a heart attack. If that pressure gets better with rest, if that pain gets better with rest or a medication called nitroglycerin, you could be having heart disease. And it's very important because a lot of times people will wait it out to see if it gets better. And it can get better. You stop feeling that same pain, but a lot of times people will start to change their lifestyle to meet their body's demands. Previously, they were hiking several miles, a couple of times a week, to just walking around the neighborhood, to walking a few times a week. They were running marathons, half marathons, and now they're only able to, walk across the neighborhood. So we have to be careful that if you're not having that overwhelming pain and discomfort, but you have change in your body, listen to your body. A lot of times people are blaming things due to the pandemic, that they weren't as active as they were previously, which is true. But you also have to realize that you could have had some issues happen, and now that you're having that discomfort, now that you're having the significant reduction in your activities, that it could be potentially something life-altering, something life-threatening. So to recap, that you have chest pain here, pain that can sometimes radiate to the shoulder, jaw. It gets worse with stress, exercising, psychological stress. It gets better with rest or a medication called nitroglycerin. Now, what can we do if you're having these symptoms? Number one, call 911. Especially if it's significant, if it's striking, call 911 for you or for your family members. Do not try to drive in certain cases, because if it's a true heart attack that you're having and you drive, you could potentially wreck that car, ruin your life, potentially ruin somebody else's life. Go see your primary, go see an urgent care, go see an emergency department, get seen as soon as possible. A lot of times people will try to wait it out to see if it gets better, and then by the time they go and get evaluated, we're not talking about treatment for potential reversing the initial injury. We're talking about treatment to prevent it from getting worse. Sometimes that you can imagine if someone is having a heart attack, there's a specific area of the heart that's not getting enough blood flow. And in that area, it gets decreased, and then zero blood flow, which can permanently damage that territory. And in some scary cases can cause something like a ventricular septal defect, ventricular rupture, aka a hole in the heart. A lot of times people who present to the hospital due to a heart attack that may have been complicated with a hole in the heart is a death sentence. So you don't want to wait it out, because you can potentially have minutes to days left. So if you're having pain that is new, go and get seen as soon as possible by your nearest primary medical provider. So what can we do? If you have enough pain, if you have the symptoms, if you have the blood test at your troponin, if you have an echo that shows areas of the heart that's not squeezing appropriately, then we may proceed with a cardiac catheterization to look for blockages immediately. There are some people, however, that their pain has gotten better, the blood test is not striking, then we can do a stress test to look for any indirect signs of areas not getting enough blood flow. We can do an echocardiogram. And if all of those are normal, we still want you to follow up because we want to make sure that you are at your best, you are back to normal. Because if you're not, then we still want to investigate whether you can have a potential blockage with a heart catheterization, sometimes with a CT scan of the coronaries. There are many things that we can do, but we can't do it if you don't show up. So for the life-threatening things, we want you to come to the hospital and get the initial evaluation. If it's remarkable, we take you to get seen and treated. If things are normal, we continue to follow up outpatient. And if further testings show that there's no cardiac cause of this discomfort that you're having, then we start looking at other potential causes. It can be your gallbladder, it could be your pancreas, it could be the chest wall cavity, it could be your GI tract, things like reflux. A lot of these issues that can affect the stomach has the side effect of having chest discomfort, sometimes with palpitations. It can be heart rhythm issues. There's so many things that could be potentially causing your discomfort. But it starts with ruling out the life-threatening issues, especially if you have concerning signs, concerning symptoms on initial presentation. So I wanted to try to keep this one as brief as possible, just to talk about the importance of heart health prevention and looking at the signs for potential heart disease. One last recap: pain here gets worse with exertion, gets better with rest, can treat it initially in the hospital with stress tests versus echo versus even doing a cardiac catheterization. If everything is negative, follow up outpatient to continue to rule out life-threatening, life-altering cardiac causes. If those are all ruled out, then we continue with the management evaluation to make sure that things like the gallbladder, pancreas, stomach, GI tract are not causing this. My name is Dr. Isang, and if you got any benefit in that, hit that subscribe button.